Good afternoon. My name is Marie Kinsella. I'm the Director of Community Programs for the Partnership for Maternal and Child Health of Northern New Jersey. I want to thank you for joining us for this wonderful panelist discussion that you're going to hear today. And I would like to start with introducing our panelists. So first we have, and I'm going to introduce them in their order of how they're presenting. We have Dr. Donnelly Campbell. She's a graduate of SUNY Stony Brook. She received her MD at Temple University School of Medicine. She is a board certified in obstetrics and gynecology, as well as addiction medicine. And for almost 2 decades, Dr. Campbell has dedicated her practice to improve the care of women in underserved areas. She has worked in New Jersey's urban areas, including Jersey City, Paterson, and Newark. Her special interests include working with women in health education, implementing centering pregnancy, promoting and supporting breastfeeding, and she's also interested in how addressing social determinants of health can help improve outcomes. So our next presenter would be Dr. Nastasha Davis. She is a licensed registered nurse with over 16 years of experience in perinatal nursing. She is an international board certified lactation consultant. And most recently, she was appointed to assistant professor of nursing at Montclair State University. Over her career, Nastasha has developed a passion for eliminating disparities in Black infant and maternal health. In 2018, she went on to found a nonprofit organization, the Perinatal Health Equity Foundation, where she serves as executive director. She is active in several national and local committees and organizations, including the Association of Women's Health, Obstetrics, and Neonatal Nursing, the Pre-Eclampsia Foundation, Black Mamas Matter Alliance, and the New Jersey Perinatal Quality Healthcare Collaborative. Nastasha's research and clinical interest include implicit bias and racism in healthcare, breastfeeding in the Black community, obstetrical violence, high-risk OB, and reproductive justice. And last, our last panelist is Linda Sloan Locke, and she has a career-long commitment to women's health and health disparities, the intersection of health and mental health, and the impact of violence on health. She has over 40 years of experience as a midwife in a variety of settings, and as a social worker has been an in-home therapist. She currently serves on the boards of the New Jersey Coalition Against Sexual Assault and the New Jersey Healthcare Quality Institute. She is also the co-chair of the Perinatal Disparities Work Group and on the steering committee of the New Jersey Perinatal Quality Collaborative. She is the founding chair of the New Jersey Health Cares About Domestic and Sexual Violence Collaborative, which envisions a healthcare culture in New Jersey where all providers in all settings recognize the prevalence and health impact of domestic violence and sexual assault and trauma-informed care, and that trauma-informed care is the standard. So without further ado, I'm going to introduce our first presenter, Dr. Donnelly Campbell.
Good afternoon. I hope everybody can hear me well. And thank you for the invitation to discuss racial disparities on maternal child health and COVID-19. So we've been hearing from our various sources through the news that this novel coronavirus is transmitted primarily through respiratory droplets. COVID-19 is actually unmasking health disparities that are already existing and the health inequities that already exist. And the 3 primary reasons for this occurring is really pre-existing conditions like diabetes and hypertension and obesity, which are more prevalent in communities of color. Also some of the social determinants of health, like economic stability, physical environment, pollution and toxins in the air and in our water, education, food insecurity, community and social context, as well as our relationship with the healthcare system, and as well as institutionalized racism. And just as in maternal mortality, even when you remove income, insurance, and education as risk factors, Blacks unfortunately have worse outcomes. As it relates to maternal child health, pregnant women should take all the same precautions as other people to protect themselves against the COVID-19 virus. We believe pregnant women should be prioritized for testing. And the few infants that we have a report of that were less than 28 days old that have gotten COVID-19, the transmission, as I said, is through exposure to their mothers, other caregivers, visitors, or even healthcare personnel. So as far as we know at this time, there is no perinatal transmission of COVID. I'm having a little problem advancing my slide. So maybe Monica, if you could, thank you. The impact of COVID-19 on perinatal women has been huge because it's really just turned our whole life upside down. Telehealth can be very useful, but I don't want us to underestimate our touch and our objective signs. In order to have telehealth for prenatal visits, we need durable medical equipment, scales, thermometers, blood pressure cuffs, urine dips. For every prenatal visit, we listen to the fetal heartbeat, and we need proper instruction. So the question is, how do we get those durable medical equipment to patients? And as well as patients need to have a smartphone, minutes, video, and a data plan. And not only do patients need to have this, but providers' offices need to have it. Now, offices that are affiliated with hospitals may have easy access to some of this equipment, but smaller private offices, which really amount to small businesses, may not have as easier time to getting all these this equipment that's needed to make sure that telehealth occurs. We also see changes in testing on labor and delivery units, and that's changing on a daily and almost seems like a daily basis. We had a change in the visitation policies in the hospital, and hopefully everybody is aware that there is an executive order from the health commissioner stating that every laboring mother has the right to have at least one support person. We have been seeing early discharge from the hospital when patients are medically stable, but also a delay in return to postpartum care in facilities just because we want people to try to stay home as much as possible. Next slide. So as I mentioned, I know people want to know what we're seeing in New Jersey specifically, and there's probably more questions than there are answers because this data is rapidly changing. I know that I had a conversation with the health commissioner last month, and we definitely have disparities in the acquisition of COVID-19 in terms of people who are being hospitalized. So we know that African Americans and Latinx populations are overrepresented than their numbers in the general population. As far as labor and delivery data, that data is more limited. There are efforts underway to try to get hospitals to report the data in terms of how many women have been tested, how many are positive, and things of that nature. But this is all from at this point, a voluntary standpoint, and so the data is not comprehensive. But I know that there's about, as of last week, about 500 women who were found to be COVID positive. But we don't have any idea how many, what is the bottom number, because people can be tested not only in hospitals, they can be tested in outpatient settings, in private labs and things of that nature. We know that last year, this time in March and April, we had about 8,000 deliveries every month. So if the prevalence of COVID is anywhere from 2 to 25%, we can guess about how many women this might affect. Next slide. So as an obstetrician, I think my perspective is that, you know, everything seems like overnight has changed. I want us to proceed with caution and common sense. We've worked hard to preserve a lot of things and to put a lot of things in place that we know have evidence behind them and have medical benefits. And we really want to preserve that. And that includes early entry into prenatal care and risk assessment for women, supportive care for the laboring mother, and whether that's with family, but also with doulas. I think it's important for a mom to have that supportive care in labor and delivery, but also breastfeeding, and only medically indicated cesarean birth. So we have to hold on to that. I think we have a lot to learn. We'll be looking back for months to come, and hopefully we'll use what we have learned to prepare for the possible next wave. Next slide. And I know Linda is going to talk about mental health and her involvement. When I talk to patients, there's a lot of anxiety that they're facing for so many different reasons. So I try to give them a positive takeaway message. And one of them is, God grant me the serenity to accept the things I cannot change. We can't change that the pandemic is here. The courage to change the things that I can. And what I can change is my reaction to all that's going on, and making sure that we're supporting the evidence-based things that we know are important for women, and the wisdom to know the difference. Thank you.
So Dr. Campbell, this is Marie. I do have a question, and also to all the attendees, if you have questions, please enter them into the chat box. But my question, Dr. Campbell, is, are the hospitals safe for delivery?
That's a great question, and I get that question on a daily basis, and I think it's important to know that the hospitals are safe. Labor and deliveries in all of the birthing hospitals are closed units. So from the beginning, we see patients, usually every hospital varies in their policy, but we usually see patients in the second trimester. We all have policies that are in place to assess patients for the symptoms of COVID. And I think many of the hospitals at this point in New Jersey are testing patients if they're admitted to labor and delivery with their consent, so that patients will know how to protect themselves and how to protect their families. We're doing all types of cleaning measures, but that's not anything new. Those are things that we've been doing all along, but I would emphasize that, it is safe to come to the hospital. It is safe to have your baby in the hospital. And one of the reasons for early discharge is so that patients can go at home and be at home where they're, as long as they are medically stable, they're being discharged early so that they can be at home and not in the hospital unnecessarily.
Okay, thank you so much, Doctor, for that answer. So we're going to move right on to our next presenter. and that's Dr. Nastasia Davis, and she is going to begin her presentation now.
Good afternoon, everyone. I hope that everyone can hear me well. Thank you to the partnership for inviting me to be part of this presentation to discuss my favorite subject, which is breastfeeding. So I want to start by just saying that human milk is safe. There had been a lot of questions about if a mother was positive for COVID-19, if she would still be able to breastfeed, or if COVID-19 could be transmitted through breast milk. And the answer is, as far as we know right now, the answer is no. Human milk has been and always has been pandemic proof. Whenever there is an emergency, the one thing you always have access to is your breast. And so in light of circumstances where we may not have access to electricity or to formula or other things, we almost always have access to breast milk. And so what we do know right now is that human milk is still safe to continue to feed and should be encouraged to do so. So in that respect, if you haven't considered breastfeeding in the past, now is a very important time to start. Because breast milk has so many anti-immune properties in it, we know that those antibodies are transmitted onto the baby. So this could be a mother who has had exposure to COVID-19 and doesn't herself have symptoms, so she could be an asymptomatic carrier, or it could be a mother with an active infection who does have COVID-19. And so she's produced antibodies to that. And so what it does is it protects the baby. The antibodies that the mother passes on through her milk protect the baby. And it's not 100% that if this mother breastfeeds, the baby will not get COVID-19 if they are exposed. But what it does do is severely decrease the odds that that happens. And also, if there is a case of COVID-19 with an infant, it is a less mild case because the antibodies are already in place. The other thing I want to mention is lactation support, for the most part, has gone into the virtual space. And so if you do not have access to a hands-on provider, most people do offer some type of provision to have telehealth. And as Dr. Campbell mentioned, there are definitely caveats to being able to do and provide perinatal care. I think one of the big aha moments for me was how much we took access to Wi-Fi for granted, and how many families don't have access to that. And so looking at what community resources can we bring together to make sure that families who need have access. So although there might not be as many in-person visits, virtual support is still a very good resource to use. There are virtual support groups. And so although breastfeeding might come with its challenges, it can be successful, especially with Black women. We are able to breastfeed successfully. We just often don't have access to the support. So I want to just put that out there that there are organizations, including my own, who are providing that support. So again, this is just reinforcing that it is protective for the baby, and it is almost in a situation where you do not have control. This is one of the things that you do have control of, is giving that extra protection to your baby. The other thing I want to talk about is the birthing process and how things have kind of changed a bit. There had been a lot of moms who were separated from their babies in the birthing process, either in ruling out a COVID-19 diagnosis or because they were in fact COVID-19 positive. And the latest data from the World Health Organization, and most recently the CDC, has even changed their stance, stating that we should not be separating moms and babies, regardless of whether they are COVID-19 positive or not. We should be keeping mommy and baby together. And so we should still be initiating skin to skin immediately after delivery. Skin to skin is one of the most important steps in getting breastfeeding off right. When we don't do skin to skin, we lose out on something called imprinting, which is basically where baby kind of makes a stamp on mommy's chest of remembering being there before. And when they go back to the breast again, they remember that scent and the smell that they left behind. And so breastfeeding it's more likely to resume with less hiccups when skin to skin is initiated, in addition to the fact that skin to skin stabilizes babies' blood glucose levels, so their blood sugar levels, as well as their temperature. So there are lots of benefits to doing skin to skin should still be continued. In that respect, we should still be doing breastfeeding initiation right after delivery. The baby should not be taken away and separated from mom. Any assessments that need to be done can be done on the mom's chest, and we really want to allow that golden hour, which is that 1 hour of uninterrupted time from the time the baby is born until the time mom is transferred to the mother and baby unit, that time is uninterrupted, that we're not taking the baby off to do weights or to do anything else, but we're allowing mom and baby to have that time together. And then the other thing is rooming in with the baby. Whether mom is COVID-19 positive or not, the World Health Organization and CDC both say that mom and baby should still room in with some provisions. So it may be necessary that the baby is in an isolette in the mother's room. It may mean that there is a barrier between the mother's bed and where the baby is set up. There are lots of creative ways to make that happen and make sure that it's safe. But rooming in with the baby should be encouraged. So if you are COVID-19 positive, how do you breastfeed? You can continue to breastfeed as you would if you were not COVID-19 positive. The only one thing you're going to be doing different is wearing a mask. Hand washing pretty much is standard. That goes with everything that you're going to be doing, whether you were positive or not. Hand washing and using alcohol-based hand rubs, if that's available, are going to be very important, but even more so important if you do have if you are positive yourself. So you want to make sure before you do any contact with either your breastfeeding supplies or with the baby themselves that you have washed your hands or used an alcohol-based hand rub if you don't have soap and water available. You would wear a mask while you are breastfeeding. It does not need to be an N95 mask, but a mask covering is required. What you do not need to do is wash the breast. There is no evidence that COVID-19 is on the breast, and so there is no need to wash the breast or do anything to prep the breast for a feeding. When breast and nipples are washed frequently, the skin becomes dry, which makes breastfeeding very difficult because the nipples begin to crack. So we don't want to do anything extra to the breast if we don't need to. And then this is from the World Health Organization on just a few tips for wearing a mask, just because often they are in short supply and we kind of have what we have. So we need to reuse them often, unfortunately. So some tips would be to try to replace it as soon as they become damp. So if you're wearing it a lot, then you're talking and your perspiration is going into the mask and saliva. So you want to change that mask when it becomes damp, that you're disposing of it in a proper location. When you are able, we should not be reusing masks, but we know based on our circumstances that sometimes we don't have a choice. But if you do have a choice, ideally we are not reusing masks. When you need to take off your mask, this is one of the big caveats with wearing a mask, is you don't want to recontaminate yourself in the process of putting on or taking off the mask. So when you take off the mask, it is best to take it off from the back, where you are less likely to have been exposed to anything, opposed to touching it from the front. If you need to cough or sneeze, of course, you do that into a tissue or your elbow if that's what you have access to, and then immediately dispose of that tissue. Of course, wash with soap and water, again, using that 20-second rule, and then regularly clean and disinfect surfaces. And I think these are wonderful recommendations. However, I know that access to supplies to clean is also very limited. So we want to be mindful of that and do the best that we can with what we have. So pumping in COVID-19. If you are a mother who has chosen that they are more comfortable with pumping over direct breastfeeding while you were still recovering, then you are just going to use some extra precautions with making sure that your pump supplies are clean, that you are cleaning them after every use. There are Medela quick steam baths, which I am a fan of, that can sanitize all your equipment for you. When you are expressing milk, you want to be using a face covering as well. And then if possible, another caregiver is giving the milk, but in not all circumstances is that going to be possible. Okay, and then just for recovery guidelines, really quickly, if you are recovering from COVID-19, the CDC recommendation is that you continue to self-isolate for at least 10 days after the onset of the illness and at least 3 days after recovery. And then the last thing I want to talk about is vitamin D. There is some research that supports that having vitamin D or a good threshold of vitamin D in your system helps to ward off something called cytokine storm, which is basically when your immune system goes a little bit crazy and overattacks your system. And so as Black women in general, we tend to have lower vitamin D levels. So now would be a good time to bulk up on your vitamin D. And if you're breastfeeding, 6,400 international units is the recommended dose. But if you have access to getting blood draws, that helps you to really determine what your vitamin D level is so that you can take the appropriate amount. So there is some protection in vitamin D. And then these are my references, and that's all I have.
Okay. Dr. Davis, this is Marie. I have a question. The question is, given that breastfeeding rates are lower among Black women, and this is just from your perspective, do you think this is going to have an impact during this COVID time of encouraging Black women to breastfeed?
I don't think it's going to change encouragement of breastfeeding. I think it's going to change access to support. Although it is really nice to have telehealth as an option, it really does not take the place of being able to perform hands-on care and being able to help a mother latch the baby on or actually observe a feeding in real life and see what's happening. So I think in that respect, a lot of mothers are going to fall through the cracks because they do not have access to the support that they need to be successful. And I know with WIC being one of the options where some people get their support and that not being consistently available through all WIC sites, I think that is definitely going to impact the number of women who are going to be successful in breastfeeding.
Okay. Well, thank you. And again, I want to encourage all participants, all attendees, if you have questions, please put them in the chat box. So right now, we're going to move to our last speaker, who is Linda Sloan-Locke, and she is going to present on perinatal health during COVID-19, mental health support, and looking forward. Linda.
Thank you. Thank you, Marie. I hope you can hear me. And thank you for having me to participate this afternoon. Next slide, please. So May is Maternal Mental Health Awareness Month, and this is really important right now because we know that mental health is essential for the total health of birthing people, their babies, their children, their families, and their entire communities. Next slide, please. So when we think about perinatal mental health, most of us think of postpartum depression, but it's really more broad than that. Perinatal mood and anxiety disorders affect 1 in 7 mothers and 1 in 10 fathers, making them the most common pregnancy complication of pregnancy and childbirth. And they can occur not just postpartum, but anytime during pregnancy or a full year after the end of a pregnancy. And they include not just depression, but anxiety, OCD, and PTSD as well. This is not to be confused with the baby blues, which occurs in about 80% of birthing people and is caused by the rapid shift in hormones. And that usually occurs anywhere from 2 days to 2 weeks after giving birth. So that if there are symptoms that persist after that, we have to look at perinatal mood disorders. Next slide, please. So there are some risk factors for perinatal mood disorders, and there are several: socioeconomic problems, stressful life events. COVID obviously is one of those. A personal history, someone who's had a mental health disorder, history of anxiety or depression in the past. Pregnancy complications, problems with babies, so having a preterm baby, a NICU baby, twins, or prior pregnancy loss. And breastfeeding difficulties that Nastasha just talked about. Next slide, please. When we talk about disparities, we see that rather than 1 in 7 for Black mothers, it's 1 in 5. So 20% of Black mothers will have a perinatal mood disorder, but they're 21% less likely to get treatment. And that's for many reasons. Some of it is stigma, some of it is access, but we know that, and we know that very often it's difficulty in having a provider or someone that you can talk to that looks like you and that you feel comfortable with. Next slide. Next slide. So now what does COVID-19 do in this situation? So for everyone, we know that there's been a lot more stress during this period of COVID-19, worry and fear about your individual health, the health of your family, your loved ones, financial problems, sadness about missed events, stress from work, either having to work from home and having to homeschool, or being furloughed, or having to go into a job because it's considered essential, and then being worried about bringing the virus home to your family. Some people are feeling very isolated, and on the other hand, some people are feeling that they have no personal space because they're quarantined together with all their family members. So there are a variety of things that can cause increased amount of stress during COVID-19. And again, as has been mentioned before, we see these disproportionately high rates among communities of color. So that is certainly a stress too. Next slide, please. So during a normal year, you see about maybe 15 to 25%, around 20% of people will say that they have symptoms of anxiety and depression. This study was done in March of this year and showed that in the entire community, about 45% of people were having some symptoms of anxiety and depression. And among women, that was higher, about 55%, and Black and white was higher also Black and Hispanic was higher also than the general, with about 50%. Next slide, please. So you're female and you're Black or Hispanic, and now you're pregnant. So here's another layer of stress. We're worried about the birth, even though we know that we can now, because of the legislation now that's actually been passed also, to say that you can have at least one person. Maybe that wasn't your birth plan. Maybe you planned to have your partner, your mother, and your doula with you, and now you have to choose in between one or the other. You may be afraid of contracting virus at the hospital, even though we know that the hospital really is safe. Excuse me. It's still a concern. Worry about bringing the baby home into a pandemic. Worries about taking the baby to the pediatrician. Worries about getting enough supplies. So there's a lot of things that are going on, particularly related to being pregnant and giving birth around COVID-19. And then, as we heard from Dr. Campbell, the increased numbers of problems and medical problems in women of color, especially Black women, and now we have this additional layer of COVID-19. Next slide, please. So what does that do? What are the effects of stress? Well, we know that a little stress is probably not a bad thing. A little stress makes you say, okay, I've got to study for that test. I need to get that project done for work. A moderate amount of stress is stress that comes and goes. There's an endpoint to it, or it's balanced by positive. But when you have chronic stress that continues over time without letting up, that's called toxic stress. And studies have shown that 6 weeks of chronic stress are enough to cause people to have symptoms of depression. And we're in week 12, I think, of COVID-19. So it certainly meets the criteria for that. Next slide, please. So what do we do? How do we cope? So this is from the National Institutes of Mental Health, and they recommend take breaks from the news. Turn off the TV, get off the social media, put the phone down, except if you want to actually call someone and connect with others, which is another important thing to do. Use that time when you take breaks from the news to unwind. Take care of your body, your mind and body. That mind-body connection is so important. Set goals and priorities each day for yourself. Doesn't have to be a big goal, just set a little goal so that you can see at the end of the day you've accomplished something, and focus on the facts. Next slide, please. If you're pregnant, take the precautions that Dr. Campbell mentioned before, and find out, so that you're not worried about the unknown, find out what's going on at the hospital or birth center where you plan to give birth. How many people do they allow to be with you? Do they have iPads that they can use to help you connect with your doula if your doula can't be with you? Those kinds of things. Connect with your healthcare provider, and it is more difficult now since some of these visits have to be remote, but you want to still keep that connection going. During the pandemic, try to keep to a daily routine. Get up, take a shower, get dressed in different clothes than you had on yesterday. And those kinds of things will help your health and your mental health. Next slide. Next slide. And finally, self-care. Whoops, go back, please. So there are several things that you can do for yourself as far as self-care goes. Exercise has really been one of the things that has been shown to help prevent depression. So about 30 minutes of walking 3 days a week can fend off depression. Now, so not everybody is going to be able to get outside and walk, but one of the good things, few good things about the COVID-19 pandemic is that many things like YouTube, there are more things on YouTube and there are more things online if you have access to Wi-Fi that you can access for free. So if you can get to YouTube, there are walking, there are various exercise programs that you can do. There's yoga that you can do. Nutrition is really important. And if you're cooking for your whole family 3 meals a day, sometimes you might forget that it needs to be nutritious for you, but you really are important, and this baby you're growing is important. You can do some self-massage techniques. This young lady has a tennis ball between her shoulder and the wall, and she's rolling it up and down, and you can do things like that to help loosen up the muscles. Sleep is another thing that is really, really important in helping manage depression and anxiety symptoms. And it's really hard if you're pregnant and you get uncomfortable. It's also hard if you have a new baby. But using the components of sleep hygiene, things like having a specific bedtime, not having any screens in the bedroom, using meditation before sleep are good. And meditation and mindfulness are also really good to help the mental health and help you center your mind so that you can get through the stressors. Mindfulness is basically just being in the moment, noticing and accepting your feelings and thoughts without judgment. One good time to do that is when you're doing your kick counts during pregnancy. You can connect with the baby, and that's called grounding. You're connecting in the here and now, and focus just on the baby at the moment. Don't start thinking about what you're going to do with the baby when the baby is 6 months old. You're just in the moment, focusing on and feeling that baby's kicking, and that's helpful to take your mind away from all the stress that's going on around you. There are some free apps. Liberate is specifically for people of color. Calm and Insight are also good, and they're all free that you can have on your phone to use to do meditation and mindfulness. And start with 2 minutes. 2 minutes you can do, and then move it up and have it be a little bit longer as you go on. Next slide, please. So if you're doing everything that you can for yourself and you're doing the self-care and you're still feeling overwhelmed, anxious, depressed, there are resources out there. And one of the good things is that most of these have gone online. So there are support groups and support networks. Postpartum Support International, March of Dimes, as well as New Jersey organizations have support groups and networks that are either virtual through video or phone, or some are through text. Next slide, please. Next slide. And there are helplines and warm lines. So that's the good news. The good news is that there is help out there. You are not alone if you're feeling overwhelmed, and there is help and folks that are out there and wanting to help you to move forward. Moving. As the last slide, we're talking about a little bit about moving forward in New Jersey. New Jersey has the New Jersey Perinatal Quality Collaborative with the primary goal of improving the quality of care provided to mothers and babies in New Jersey. And these initiatives are looking at things like reducing C-sections, reducing hemorrhage and high blood pressure and severe complications from those problems, and working on reducing racial and ethnic disparities in our state in maternal and child health. So regardless of the pandemic, we are looking forward and trying to move forward to improve the health of our moms and our babies here in New Jersey. Thank you.
Marie, are you there?
Yes. What treatment options are available for postpartum depression?
So first of all, as I said, postpartum depression is one of the postpartum perinatal mood disorders. Anxiety is actually right now presenting more than postpartum depression. So there are many things that you can do to treat postpartum depression or anxiety. The first step is usually talking with a therapist, and again, you can connect with people through the warm lines and the helplines that we have in the resources. There are a variety of different kinds of therapy that are helpful, either group therapy or individual therapy. And there is also medication, and there are medications that can be safely taken both during pregnancy and postpartum and with breastfeeding if you're at a point where you need that. But usually what happens is that you start with talk therapy to see, and perhaps needing to see a psychiatrist to assess exactly what's going on. If things are really getting to a point where you're totally overwhelmed and you need medication, it's important to know that there is medication that you can take that is safe.
Okay. I have another question for you. What domestic violence services are available during this time?
So all of the domestic violence hotlines in every county are working. So every county in our state has a domestic violence program, and those programs all have hotlines as well as the statewide hotline, and there is a national hotline as well. And there's also a national text for domestic violence, and those are in your resources. Those are working. So there may be some limitation on the availability of safe houses, but if there is no safe house available in your area, you can be referred to other resources so that you can be safe. Unfortunately, during this time of COVID, sometimes there is an increase in domestic violence. If there was domestic violence in your relationship before COVID and now you're quarantined in the same residence as your abuser, it can be a dangerous situation. So reaching out to the hotline is something that you can definitely do.
Okay, I'd like to thank you. And right now we're going to invite everybody to turn on their camera, and we're going to have a discussion for approximately 15 minutes. I will be joined with Amy Gohl, who is the Director of Professional Education at the Partnership. So, ladies, and I know that Amy has some questions for you. So, Amy, do you want to start with the questions?
Sure. Thank you, Marie. And I want to thank all of our presenters. I've been monitoring the question box, and there have been many positive comments about the presentations and what was said, and a lot of thank yous. But we do have a number of questions that I'd like to pose. And I know Marie also still may have some as well. So we have two general questions about where to obtain masks and also where to obtain diapers. I don't know who has the most expertise in that. I think it might be Marie.
Well, you know what,
yeah, it's a good question. I was in CVS this morning, and they actually are selling masks in CVS. So I think as more and more we need to use masks, probably they will become more accessible. And I know online you can see some ways to make your own, even without having a sewing machine, which many of us don't have anymore. So yeah, it doesn't actually, any kind of face covering is okay as long as you aren't in a situation where you need a medical grade mask, right, Dr. Campbell? So, right. So a cloth covering, any kind of cloth covering like a bandana would be something that you could use.
Yeah, and actually, I also happen to be the president of the New Jersey Medical Association. And so we actually are promoting people using scarves, using bandanas, and there's even, back to YouTube, and even on the CDC website, you can actually make a mask using an old t-shirt. So on Saturdays, sometimes I'm in front of my church showing people how to make a face covering with an old t-shirt. And it's really an important issue because it doesn't have to be anything fancy. You don't have to go online and spend, tens of $20s on these masks. But also maybe Amy or Marie, if you put my email into the resources, the New Jersey Medical Association is actually providing masks, face masks for community members. And we're doing that because we want to save the N95 masks for the healthcare workers that really need them. But we have community organizations that have been sewing masks, and we're giving them out. So I would be happy to mail people these cloth masks that can be washed and be reused, because as Nastasia mentioned, if the surgical masks, if they become damp, they do need to be thrown away. But with the cloth masks, you can actually reuse them.
Okay, and as far as the diapers are concerned, when you look at the resources, there are resources there that note the partnership, and our central intake specialists, and by the way, there's a central intake specialist in every county. They usually have resources that they can direct families to for diapers. A lot of the food pantries now, and you would do well by calling your food pantry, are actually supplying diapers to families. So I hope that helps.
That's great. Thank you. And just to remind everybody, we will have a resource list that we will be providing, and we'll also provide Dr. Campbell's contact information as well. So we have some breastfeeding related questions for Nastasia. Should we be moisturizing the breast before labor?
Hi, I apologize. My camera is not connecting, but I am here. I would say not anything unusual that you would normally do with your breast. You don't need to really use any special type of lubrication on your breast. If you happen to have dry skin, then that's a different issue. But as a standard, no, you don't need to really do anything special with your nipples. That there actually are little glands in your breast that actually help to do that for you. They're called, you might see them as little bumps around your areola. Those are your Montgomery tubercles, and they actually are glands that lubricate your breast. So you don't really have to do much. Nature has set you up. You don't have to do anything.
Okay. And how about, you mentioned, you talked a little bit about breast pumps. What about cleaning the pump? Do folks only need to use soap and water, or do they need to use disinfectant if mom is COVID positive?
Disinfectant would be preferred, but if you don't have access to that, like I have tried to buy Lysol wipes, and I know many of us have, in sprays, there's nothing that you can purchase. So use what you have available to you. You also want to read the instructions on the pump, because you don't want to use things that will damage the pump either. But try to, keep it as clean as you can, and wipe it down at least after use with a moist cloth if you don't have any access to any type of material to clean it with.
Great.
And I would add that in washing, just same way that we talk about washing our hands for 20 seconds, those pump parts, you want to make sure you're washing for 20 seconds. So, we think about when we put on a little hand sanitizer, how long it actually takes for 20 seconds to go by. So when you're washing anything, just keep that 20-second time frame in mind.
Absolutely.
How can a mom find out about signing up for WIC?
Well, that would be through your local WIC office. So it depends on where you live regionally so that you can get access to signing up. I don't have any latest updates. I don't know if you do, Marie, of when WIC offices are opening and serving women. I know recently they had not been open and some were not taking new clients. So I would highly suggest making a phone call before traveling to any WIC office, because they may not be taking in-person visits. A lot of their intakes are being done by phone. But if you check the, which we can send out as well, I think that they're all on the state website, regionally where each WIC office is, and then you could set yourself up with an appointment there.
Exactly. There is a state helpline, and so people could refer to that. But as far as I know, all WIC is open, but they're doing all of their intakes by phone.
Yeah, they are doing all of those those certifications and research virtually, and all of them are open. So again, you know, the resources will be sent out. I really encourage everybody to view the resources that are going to be sent after the after this presentation, and just call your local consortium. I know at the partnership we do have central intake in 5 counties, and again, we've been directing folks to call and get their appointments through WIC virtually, and those appointments are being fulfilled.
Right. When we speak of inequalities and racial disparities, how do you socially isolate when you live in a multi-generational home and with limited support?
Yeah, I mean, that's a fantastic question, and that's why we see, quite frankly, in particular with this illness, how it's affecting us, because not everybody is going to have the capacity to socially isolate. And I think, as Nastasia mentioned, we do the best that we can. So everybody can't have a separate bathroom that they can use. They may not even have a separate room that they can use. If someone, though, has been diagnosed as being COVID positive, then I think that's where it becomes so important to wear the face covering, wash hands, wash the surfaces. If it's possible, you know, in terms of using disposable plates or cups, but if that's not possible, just making sure that you're washing that plate, that cup, the utensils that you eat with for the 20 seconds. The 20 seconds is really important because it takes that time for the soap to break up the viral particles.
I want to add into, I think a lot of people have taken the social distancing piece in isolation as in you need to stay in the house, and you don't need to stay indoors. You can go outside, and I think it's really good to go outside, even for your own mental health and well-being, and then again getting some of that vitamin D. Do go outside. I know my daughter's school recently hosted a social distancing hike with the students, and they all wore their masks and they kept their distance and they went for a walk. You know, try to be creative in the things that you can do to kind of give yourself a break from other people, because I think everyone needs that.
And as far as your mental health, like I said, some people are feeling isolated because they're home alone, but other people are home with a lot of people. Try to remember to get that positive thought every day. Maybe now is some time that you can actually use this time to connect with some of the folks in the older generation in ways you haven't been able to do that in the past because everybody was so busy. So it does make it more difficult, and it certainly does add to the disparities. But you know, we're good at making lemonade out of lemons. We've been doing that for 400 years. So right, Tamale. You know, we're really good at being resilient. We're resilient people, and we just need to remember that and try to find the positive as much as we can.
Thank you. The next question is a little bit off topic, but I think I should mention it because I believe it has importance. Is it required for all people around a newborn in the home to receive the Tdap shot? If so, what if they aren't able to get the shot, and what should the mother do?
Yeah, that's an awesome question. So we definitely ask, because Tdap is a vaccination that people receive against what's called the whooping cough, which is another illness. It's another respiratory illness. And the reason we want to vaccinate the people in the home and caregivers is because our babies can't be vaccinated against the whooping cough in the first 6 months of life. So we do offer that vaccination to pregnant moms, and we do actually usually refer. Now, it brings up an awesome point because all these referrals have now come to a screeching halt because you can't, where offices are doing telehealth, and a vaccine is something you can't get over the phone. You got to come into the office. But what I would recommend people do is contact, their local health departments as a resource. Also, some of the pharmacies, even prior to COVID, were giving some vaccinations. And then talk to your provider, because your provider may have a resource for how you get the vaccinations. I also want to just mention from the medical side, for women with children under 2 years old, actually the Academy of Pediatrics, the American Academy of Pediatrics, is still recommending that all children under 2 years old still come into their pediatrician's office for face-to-face visits, because you know that children receive a lot of vaccines in the first 2 years of life. And what we don't want is to have a resurgence of vaccine preventable illnesses like polio or measles because people are not getting their vaccinations. So I think it's a really important question. Look at your health department, find out resources from, from your provider in the community, and also look at the pharmacy in your community because they may also be able to give you that vaccination.
That's really, thanks to Molly. And some of the pharmacies, I just found out mine, actually have the older people's hours now, just like the grocery stores do. So I was, yay, older people. So I was able to take advantage of that this morning. So that, like if people are worried about being exposed, that's another thing to do. You can reach out to the pharmacy and find out if they do have special hours and they are giving vaccines, and reach out to the pediatrician also, because it's really important, like you said, that we don't move 50 steps back in another area with things that are preventable. Most pediatricians, I was just on a call with the American Academy of Pediatrics this morning, and most pediatricians' offices are trying to address this by having specific time for well children only, and they're not going to be seeing any sick children. They're taking precautions about screening families, both the child and the parent, before they come into the office, to make sure that it's safe for them to come into the office to get those vaccinations that they need. So that's a really important question. I'm glad that you presented it to us.
So I just want to say that we're out of time. I would like to give each of the panelists 30 seconds to give us a takeaway message, in terms of, Linda, what you said was very encouraging a little while ago, that, 400 years we've, you talked about the tacos and the lemonade. So again, just a takeaway message from everybody. And then Amy, we can close out.
Okay.
So Linda, do you want to start, and then Dr. Campbell?
Yeah, just remember that our mental health is just as important as our physical health. The two are intertwined. We can't, like you think about what they say, if you get on an airplane, if we can remember back to those days when we could get on an airplane, you have to put your own oxygen mask on first, or you're not going to be able to help anyone else. So we really need to pay attention to our own health and our own mental health.
Okay. Dr. Campbell?
Yeah. I just follow up with mind, body, and soul, and so all of those are interconnected, and we need to pay attention to all of them. And
Dr. Davis?
I have two things that I want to add, just because this is not a close-up thing, but I need to say it because Dr. Campbell reminded me when she mentioned 2 years old. When we talk about masks, they are not for children that are under the age of 2. And I don't think that got mentioned today. And I really just want to highlight that because I'm seeing a lot of photos on social media of young children with masks on, and it's very dangerous for them. So please use the mask yourself as the adult, and those that are over the age of 2, have them wear the mask, but the babies and the children under 2 cannot wear a mask. The other thing I want to just add is this too shall pass. This is not forever. We will move beyond this and we will come out of it stronger. And so we have better things on the horizon. We will get through this time. And there is support around you. There are lots of virtual support groups that are happening. You can find your space online for right now, but know that there is a space for you somewhere.
So again, I'd like to thank our panelists and those of you who attended our presentation, and please make use of our resources. Those will be sent to you. And if you do have any questions, we will try to answer them, you know, some way. Just send them through the chat. Yeah, go ahead.
Yes,
Amy.
just two brief things. I also wanted to thank our panelists and all those who joined us. We did have a question in the chat about the resources. They are mostly targeted to New Jersey, but apparently we have folks that have joined us from outside of the state. Some of the resources are also available nationally, so you will be able to make use of those. This presentation has been recorded and it will be available through the partnership website, which is www.partnershipmch.org. So if there's anything you want to hear again, you will be able to access it.